welcome back to Rethink Healthcare. I'm Tanya Stendy.
Paul Montenegro.
And today, continuing in our series on system controls, we are going to talk about the electronic health record as a control, as a system control.
It is a very big system control.
It is, yeah.
I mean, we started paper, and then now we're all electronic.
Yeah,
right?
for sure. I was on paper to start with.
Yeah, I mean, remember we were in school, our notes were handwritten.
Yeah.
Flow sheets were hand done, orders were hand done, transcribed by the nurse.
Yeah. My writing muscles have become flabby.
My writing was atrocious to begin with anyway.
Well,
so
there's a reason why it was atrocious.
EHR was actually a very welcome thing because then they could read what I was trying to say. I mean, just to start with, what are your thoughts on EHR? EHR meaning electronic health record.
No, I 100% prefer it. However, having said that, I was on EHR when I worked in the emergency department. Okay. So that was starting in 2002.
Okay. And
that's because it was a hospital system, of course. So I think they were certainly using that before sort of private practices were. And then, of course, by the time I went into private practice, we were on EHR as well. So I didn't have a lot of time using paper. I can sometimes see where it might have been quicker. I think things take a little bit longer with EHR for many different reasons, not the least of which is it being up and available to use. But I, in general, I think it's good. I enjoy it because I'm very consistent, and I think that's important too.
So let's when we talk about the system controls in the EHR, I mean there are certain triggers within the systems to actually improve care.
Yeah.
Right.
Yeah.
I mean, let's shoot some examples. Like allergy alerts.
Yeah.
I mean that's a big system control there. Like when we try and order a medication, and if there's a cross sensitivity or there's an allergy to it, it'll just pop right up, say, hey,
Exactly.
I don't think it really stops you from ordering, but it will alert you
in very strongly worded language. Like in my mind, it will be like there'll be like a yellow pop-up and then there's red pop-ups, and it'll make you click through a few things if you decide you want to override it. It doesn't stop me though from asking every single time because sometimes it's not in the system. Yeah,
like the interactions I like, but there's a point there too. When we talk about overriding, I mean I've overridden stuff too. Just because, if this patient's been on this and they've been tolerating it, then I just put a note there saying, hey, previously tolerated, proceed. But the amount of times that we have to sometimes override something becomes a system issue. Because then we as the users may get desensitized to these alerts in the act of overriding. And that could potentially cause an issue because then we get system numb.
Yeah.
What do you think about that?
No, I agree. You get system numb in so many, not just the overriding issues, but also just other things like other alerts or warnings, and they just pop up over and over. Yeah. So that's a thing.
Yeah. So I think from my point there is as the users, right, or viewers are most likely going to be users of the systems. Be aware of that and don't just click through.
Yeah.
I mean, really think it through. And even a couple of occasions that I've had to really dive back into saying, what is that alert really telling me, and is there anything more I have to do? So I've kind of done my own backwards investigation, but I couldn't do the investigation at that point in time just because we have a lot of time constraints.
Yeah. Yeah.
So
I mean, it's so and there is when we were on paper, you had to ask those questions every time because it might be on the paper chart somewhere, but you weren't flipping through looking for it, so you just asked, and it forced you to think about it a little bit more. And so if there's any downside to that, is that I you have to think less a little bit on EHR. You definitely do.
Here's one of the drawbacks, right? Because when AHR is a computer system generated software, right? Now, from a software perspective and any software designs, we always look at what you call the Swiss cheese model. Are you familiar with the Swiss
No.
cheese model? So the Swiss cheese model is that there's always going to be a failure somewhere. And failures, if you look at a Swiss cheese, have different holes, different size holes, different types of holes, right?
Yeah.
Now, when we say something is a Swiss cheese model failure, meaning that a catastrophic event occurred because all those holes lined up.
Yeah.
Right?
Exactly.
So, like, if you look at a Swiss cheese and you cut Swiss cheese, I mean, naturally, the idea is like these holes won't line up in a,
Yeah.
a system will catch a potential failure.
Yes. Yeah.
There's always a failure somewhere.
Yeah.
Now, if we think of our electronic health records, it's what from a system analyst, somebody who analyzes software per se, right, and software failures. It's what we call like a loosely coupled system because. And when I say that is that it's loosely coupled because the healthcare system itself, although very intricate by design, it's loosely coupled. So then that way you don't have what you call a software failure, meaning we have those alerts, allergies to this, right? But then somebody still needs to dispense that medication. So pharmacy gets involved then and we'll get the same alert.
Yeah, so there's catches. Right.
So the idea is that, okay, that's why I say it's not an automated, we ignore this or we say, okay, proceed, automatically given to the patient.
Right.
Right? Because
it's not like an automat where you push a button and it drops out.
Yeah, that's a tight control system, right? This is loose control system or loosely coupled system, right? Not that, that's what I'm referring to. It's a loosely coupled system because there's still some sort of intervention somewhere in between that's not dependent on the other one.
Yeah.
So for example, like when we talk about medications, we may order this medication, system alerts us, okay, hey, there's a warning, there may be cross-sensitivity or, there may be interaction with this.
Yeah.
Pharmacy will still need to dispense that. So they become a system to itself in their own rights within their own system, but also as the pharmacist dispensing will be able to make a human calculation, right? But then again, from our perspective as nurse practitioners, right? And then you have the nurses, if the hospital system, the nurses will still need to dispense that. So the nurse alone dispensing is a system unto its own, saying, hey, is this okay to be dispensed? Can I give this patient?
Right.
So hopefully the whole idea there, that's why it's loosely coupled, is that everyone will have a chance to give their input and say, is it safe?
Right.
Now, if an event does occur on this loosely coupled and then an undue outcome occurs, let's say a bad allergic reaction develops, right? Then we say, okay, that's a really bad system failure because then really all the Swiss cheese lined up. It went through multiple hands for it to fail. Now, the one aspect that I sometimes feel, and this I don't really like per se, is that there's a bit of an over-reliance on the system sometimes.
Yeah.
And for example, and this is where I say is because pharmacy may alert me of an interaction, but what I don't like is they'll just fax it to my office.
Yeah.
Or they'll email it to me.
Yeah. You might not even get it for 3 days.
That's my point, right? So like, okay, well that system's flawed and failed. I mean, you would think that, hey, if there's something really concerning, I mean, I'm always like, dude, pick up the phone and call.
I know. It's so funny because it's like, why is it so hard to pick up the phone? But it is. Sometimes I don't want to pick up the phone either. I'm like, I have to have a conversation. But I have pharmacists who call me and say, are you sure you want to do this? And sometimes I've been wrong. Like, I'm like, oh, wait, no, I don't want to do that. Thank you.
So that's where the system controls in healthcare per se, the electronic health records are, it's very interesting to me, just because like at what point is it acceptable to do what
Yeah.
from a cross-check perspective?
Yeah.
Because it's designed to have those cross-checks.
Yeah.
But then why do failures still occur?
Yeah.
I mean, was it last year or 2 years ago? There was that lawsuit on first time they ever convicted a nurse for a patient's death, and I didn't review it in detail, but I did review the case, and the nurse apparently ignored a lot of these warnings, and one of the warnings that was ignored was going through the Pyxis system, which if a viewer is not aware, Pyxis system it's kind of like a vending machine of a medication.
Yeah, exactly. I was just going to say it's like an automat. You put something in and you get something.
Yeah, but then within that, it's not just a matter of I want this medication, give it to me. It's you still have to put in the patient's name on it.
Yeah.
It's got to verify it is stocked by a pharmacist, so
Yeah.
it's not just like automated there.
Yeah.
I mean, yes, there's stock drugs that are there, but then there's certain medications have to be stocked by the pharmacist. So there are still controls. But then again, you can also override those. That's why my point is we have to be very careful about being sensitized to overriding these alerts. I think
Yeah.
we need to really take a step back. It's okay, what does that alert really mean?
Yeah.
And how crucial is that alert?
Yes.
And maybe there should be different levels of alert. I mean, and that's the system designs may vary on that as far as how much level of alerts do they want to give.
Agreed. Yeah.
So, yeah, it's very concerning to me sometimes, because I think that's where the software design matters more.
Yeah. Agreed. So I think I don't think there's any going backwards, of course.
Oh no.
But what can we
by all
do then
means.
to fix? Is there anything to do?
Certainly. Yeah, I mean, I think
what are your
I think the goals really are to have zero of this of these catastrophic events,
Right.
right? And it's just a matter of how do you improve the different layers. I do agree that the systems need to really be like loosely coupled, right? Because then there's no automated one person making a decision and it's just
Yeah.
zipping the order right through, right? So everything needs to be decoupled here, but then with those decouplings, you maintain the system. So I like that format, but I think the design of the format is to have more human intervention.
Yeah.
That's the pause is within the human intervention.
Right. But that, of course, and that's what it's been trying to get away from. But we need to add that back in.
It has to be, and maybe that's, maybe the issue there, and actually, if you look at some of the studies being done, right, there's a really ironic study that done before wherein they looked at medication errors, and they found that the more highly functioning a team is, the more errors they made.
Wait. In what way?
In what way?
Yeah.
Because they were reporting more errors. They felt the environment was safe, that there's an issue, they could speak up. So the
Okay.
reporting of any issues
Okay.
are much higher, as opposed to the
Oh, I see what you're saying.
teams that don't
Yeah.
function as well. They tend to hide more
Yeah.
information.
So it was
the
a good thing.
reporting is less. Yeah, it was a good thing. Yeah.
Yeah.
So it was actually the paradox on what they found, but then they really, at first they thought, wow, our hypothesis is really off, but then no, they were really onto something there,
Yeah.
right? But and that went into more from the human perspective, right? It's a psychological safety within the environment.
Yeah.
So it's very important for providers, nurses, anybody within the healthcare field to really be able to speak up,
Yeah.
right? So you have these automated systems, but then also that human within has to be able to speak up, and they need to be able to feel safe to speak up.
Yeah.
The airline industry uses this a lot, right? I mean, here airline industry is very regimented with
safety
roles,
controls,
right?
yeah,
But they
yeah.
have a lot of safety controls. But then they've learned that when they did analysis on where do we fail, failures occur as human errors. And then they're like, we have all these safeties, why do we still have all these human errors? And what they found was it was that safety control. It's the culture of safety within the hierarchy in the airline industry. Captain, co-captain,
Yeah.
or however, right? The captain is in command, right? But then what they realized that if we have a very, very strong captain is his way and everyone just follows what he does, that's where the accidents occur.
Yeah.
So the whole environment now is really changing into you have to have allowed the whole team. So let's look at the cockpit.
Yeah.
Everyone in the cockpit needs to be able to speak up that, hey, we have an issue here,
Yeah.
right?
And feel comfortable doing
And
that.
feel precisely the point. Feel comfortable doing that.
Yeah.
So for our viewers who are nurses, you need to be able to be comfortable saying, should I really give this drug?
Right.
Yes, I know you ordered it.
Right.
You, meaning whoever,
The provider is.
provider, nurse
The next level
practitioner,
up.
surgeon, right? Whoever ordered that, right? You shouldn't be intimidated
Yeah.
by them or by their status. Say, hey, that's what I ordered. You carry out what I ordered. No, you need to be able to speak up then,
Yeah.
because you're part of.
But we do
The actual
learn
system
that. You
control.
do learn that in nursing school. You do learn that you have, because yes. So one of the things that is positive. There's lots of things positive about nursing school. So I'm not. Yeah, I'm not trying to make it sound like. But one of the things is positive about nursing school is it does teach you that you are a very important part of the healthcare system, and it isn't just us following doctor's orders like it maybe was in the old days.
But then the
Because it's
environment,
important for the nurse.
but they need to have the psychological safety to be able to then say it's now okay. But that's where some of the issues are, is there psychological safety within?
Mm-hmm.
So maybe that's why some of the reports that we're getting back are just emailed to us or faxed to us. Hey, I alerted them quietly.
Right. Right.
I mean, that's a, so when
It's not my fault. I told them.
yeah, this is the mode I told them with.
Yes, yeah.
Here's my fax verification.
Right. Yeah.
No, so the whole point there is to
Human
really,
to human.
yeah, exactly.
Human to
If
human.
you find an issue, right? Because for the Swiss cheese model to really work and catch these errors, these flags need to be put up.
Yeah.
And it could be put up by anybody within that system. Now, the whole point to that is if you think there is an issue, that is actually the time of what you call your cure period. That is when you could try and rectify the issue. Because if you let that time go by and the issue keeps going down and a failure occurs, then the whole system failed.
Yeah.
So keep in mind that every single part of that system is valuable. You know,
Agreed.
it doesn't matter, even if it came from up top here, all the way down to trickling onto. That's how we're going to be able to prevent. And that's where I think EHRs could do better, but I think the human needs to intervene more
Yeah.
within the EHR
Yeah.
system.
So this episode is boring because we don't have anything to argue about here.
Pick a fight somewhere.
I agree. I agree with you on all. Agreed on all.
No. Is there anything else you want to bash EHRs?
No, not at all. Actually.
I mean, I have issues with EHRs. I mean, I
Yeah.
think they're inefficient.
Yeah, but there
Truthfully.
needs to be those slivers,
You know?
where this is EHR, and then this step is a human, then this step is EHR, then this step is a human. There needs to be the human involvement, and that's what we all need to understand.
And those slivers are in there by design.
Yes, exactly. All right,
Thank you for tuning in, and we look forward to seeing you on our next episode.
great. Bye-bye.
Bye.